COVID-19 has become the virus we all love to hate, with introverts hating it just a little bit less. Masks have become a staple, which is fine by me because that means it's even harder to see my resting sad face. However, with the news of the Pfizer and Moderna vaccines, hope seems to be on the horizon. Soon, I might be able to breathe in the fresh air and actually be able to see in something better than 320p. But with the vaccines, some are skeptical, claiming that the vaccine was developed too fast, and I'm not sure what the long-term effects are going to be. Now leave me in peace as I sip my sixth margarita and smoke my cigarette. So I thought we could go through a research paper detailing the safety and efficacy of the BNT162b2 mRNA COVID-19 vaccine, also known as the Pfizer vaccine, to see whether or not these fears are unfounded. A quick introduction to those of you who have been living under a rock for the past year. COVID-19 has affected tens of millions of people globally, with older adults, those with pre-existing conditions, and frontline workers at the highest risk for complications. This new vaccine that has been developed is a liquid nanoparticle formulated, nucleoside modified RNA encoding the SARS-CoV-2 full-length spike modified by 2 proline mutations to lock it into pre-fusion conformation. Now, that was a lot of big biology words, but what it basically means is that they took the spike protein, which normally allows the virus to fuse with the host cell, and made an RNA strand based on it with 2 important mutations, which prevent it from fusing. This allows the immune system to indirectly learn from this RNA strand and know what the COVID spike protein looks like so it can destroy COVID if it sees it in the future. Now let's go through the methods section of the paper. The study recruited 43,448 participants who were randomly assigned in a 1-to-1 ratio to get the vaccine or get the saline placebo. The participants were 16 years or older who were healthy or had stable chronic medical conditions, including but not limited to HIV, hepatitis B, or hepatitis C. Exclusion criteria were a medical history of COVID-19, treatment with immunosuppressive therapy, or diagnosis with an immunocompromising condition. The group that was given the Pfizer vaccine were given 2 doses, one 30 microgram dose given the first day, and another 30 microgram dose given after 21 days. The group that were given the placebo received an equal amount of saline with the same injection pattern. All injections were into the deltoid muscle. They determined safety in 2 ways. One was by asking patients to tell them any specific local or systemic adverse events or use of pyretic/pain medication within 7 days of receiving each dose of the vaccine or placebo. The other was to record any adverse events listed by the patient unsolicited for 6 months after the second dose. Unsolicited, meaning that the patients called themselves to express their symptoms, not the researchers checking in. To determine the efficacy of the vaccine, they looked at the infection of COVID-19 in participants with the vaccine or with the placebo. COVID-19 was defined as the presence of at least one of the following symptoms while being tested positive for COVID-19 with a respiratory specimen. Now let's take a look at some of the results from this paper. In this table, we can see the demographics of the populations that were included in this trial. Keep in mind that the countries in which the 152 sites were located were in the United States, Argentina, Brazil, South Africa, Germany, and Turkey. Based on that, we can see that the sex is roughly equal, and the demographics are fairly consistent with the US with some overrepresentation of white people. We can see that they got a diverse range of ages. We can also see that the average BMI is 35, which is in the obese range, but it is the most common comorbidity when it comes to the US. In this figure, we can see the local reactions to the vaccine and placebo groups when the patients were asked about symptoms. They defined the mild, moderate, severe, and grade 4 in the following fashion. Mild does not interfere with activity, moderate interferes with activity, severe prevents daily activity, and grade 4 is emergency department visit or hospitalization. When it comes to reactions at the injection sites, we see that a lot of people who receive the vaccine get some pain at the injection site in comparison with the placebo when solicited. This is understandable, but relatively minor in the grand scheme of things as it's only mild or moderate pain. Pain was also reported less frequency in adults greater than 55 years old than those under 55 years of age. In general, local reactions were mostly mild to moderate in severity and resolved within 1 to 2 days. In this figure, we see the systemic events that could occur because of the vaccine. The most commonly reported systemic events were fatigue and headache, although these side effects were also reported by many placebo recipients. Severe systemic events were reported in less than 2% of vaccine recipients after either dose, except for fatigue and headache after the second dose. So, overall, this isn't a very gentle vaccine, but it's not bad in terms of side effects. In addition, daily use of the electronic diary in which participants listed their symptoms ranged from 90 to 93% for each day after the first dose, and from 75 to 83% for each day after the second dose, with no difference noted between the vaccine group and the placebo group. This tells us that variances in the data were not necessarily due to underreporting. So, in terms of side effects, more people who got the vaccine had side effects compared to placebo, but these were usually mild to moderate in severity. A few had vaccine-related serious adverse events, but this is in a population of tens of thousands of people. When looking at the efficacy of the vaccine is pretty effective with a 95% overall effectiveness rate. Only 8 cases in those without prior COVID infection as compared to 162 cases in the placebo. Even when we include those with prior COVID infections, we see about a 95% effectiveness rate. Even when we stratify this by age, sex, race, and country, we see pretty good and even efficacy rates across the populations. This graph shows cases of COVID-19 or severe COVID-19 with onset at any time after the first dose. Between the first dose and the second dose, which is at the 21-day mark, 39 cases in the vaccine group and 82 cases in the placebo group were observed, resulting in a vaccine efficacy of 52% during this interval. So we can see we get some protection early from the first dose of the vaccine as soon as 12 days after, but it's really that second dose that boosts it up to 95% effectiveness rate. The authors of this paper note that the participant size is not large enough to detect less common adverse events reliably. Also, since they only followed up until 3.5 months after vaccines, the occurrence of adverse events more than 2 to 3.5 months after the second dose and more comprehensive information on the duration of protection remain to be determined. This report also does not address the prevention of COVID-19 in other populations, such as younger adolescents, children, and pregnant women. My conclusions are this. The paper has shown that the vaccine is very effective, at least in the short term, and with our knowledge of vaccines, it will probably continue to be effective. In terms of safety, the symptoms for most people are mild to moderate in severity. And looking at it in comparison with the symptoms of COVID, the side effects are definitely much better than those. As vaccines continue to be produced and rolled out, we will continue to get more and more data that I hope and believe will just back up what we are already seeing. But since the vaccine has been slow to roll out anyway, I think that if you have the opportunity to get the vaccine, you should get it to not only help yourself, but those around you. Thank you for watching. If you'd like to see more stuff like this in the future, be sure to like and subscribe so you don't miss any of my videos. I hope you all stay happy and healthy.